Well, some health freaks, if you want to call them that, swear by vitamins to keep them fit and healthy. But can something like vitamin D and other supplements have any impact on COVID-19? The National Institute for Communicable Diseases, Professor Adrian Puren, with us once again this morning to discuss this. Adrian, good morning. And I suppose, I am one of those health freaks. I religiously take my little battery of pills every morning, and I suppose that's what's kept me healthy so far, I'm hoping. But specifically, I've seen an article. Let's start with vitamin D. Does vitamin D play any role in fighting this virus?
Well, it comes back to your point. You're taking the pills, but is there any association or causation between your good health and taking those pills? So if you look at that vitamin D story, I think it's similar to what we've seen with the BCG. In other words, it's an observational study looking at mortality and the use of vitamin D, and shows quite a nice association between lower death in countries where there's obvious fortification of vitamin D versus countries that apparently don't. But I think those are associations and not necessarily causation. And the sense is that it's probably we have to think a bit more broadly than just vitamin D. I think most people do have a good intake of vitamin D, but there are certainly situations where people are deficient. So again, I would certainly caution not to go out and load up on vitamin D. In fact, the excess of vitamin D can have actually side effects which are not very pleasant. So I would really caution about looking at vitamin D in isolation. Similarly, I think with all the other trace minerals and elements and vitamins and so forth, I think we need to be cautious. I know that, for example, in China there is certainly a belt, I believe, of selenium deficiency as an example, and it's thought therefore the poorer outcomes were associated with with regard to the poorer outcomes were associated with selenium deficiency. So again, selenium is an antioxidant. It certainly plays an important role. But again, I think that we need to be cautious about supplementing when there is no actually need for supplementation. I think many of our diets, I think, are sufficient to cover all our specific requirements. I think only when there is evidence that there is deficiencies that one actually does that. So I think these elements, trace elements, the vitamins and so forth, are certainly important around our immune functions. But again, it's not the whole causation of poor outcomes.
Well, vitamin C, we know for decades we've been hearing about the benefits of vitamin C. That's for a common cold, daily health as well. So vitamin C and zinc, though. Zinc has been the other thing that we've been told we must have during this time. Just what does that do for us?
Yeah, so again, I think it's one of those trace elements which is important in some of the biochemical pathways, but my sense again is that, like the vitamin C, I don't think there's really good evidence that taking vitamin C in addition to what you're normally taking in, similarly with zinc, is actually going to be of great benefit. So I think I know there's a whole debate, and I'm sure I'm going to be trolled for saying these things, but I think we really need to be cautious. I think most of our diets are well fortified with what we require, and then taking the excess pills and so forth may well be important from a psychological aspect, but I think in reality, if you don't show a deficiency, I think there's no point in taking these particular supplements.
So things like vitamin C, like zinc, the things, and selenium, the things that we're told that we should be taking at this time to help us fight this, is there a danger, like you say, vitamin D, taking too much of that could have some nasty effects on you? Things like vitamin C, which are supposed to be, we're told, are good for us, things like zinc, could they also have nasty side effects? Could you take too much of that and not something you should be taking long term?
Yes, again, I'm not too clear on some of that. I know vitamin D is an obvious example. Vitamin A is another obvious example where, in fact, you can have levels of toxicity, in other words. So that's why I would really urge caution around taking these particular elements. I mean, some of the vitamins are water-soluble, and therefore you'll simply excrete them. They may not have marked effects, but others certainly can have side effects that you don't really want to have, such as diarrhea, for example, or excess calcium being deposited in the case of vitamin D.
So just for the sake of those who've been stocking up on all that vitamin C and the zinc and all of that, Prof, I mean, should we just do it for now, in the time that we are now in the storm, that we are dealing with the peak of COVID-19? We're not telling people not to take them.
You can take them, but I think the benefits are not obvious or clear from the various studies in terms of other diseases. I think that we need a good immune system, so good nutrition is really obviously clear from that. So I think what we ingest in terms of the foods that are available certainly provide that. I think there's only particular circumstances where, for example, you are deficient. So, for example, if you are in a frail care home with minimal exposure to sunlight, then yes, the vitamin D deficiency may well be an important role there. So I think that's where the settings are, where you would actually apply supplementation. But if you're out in the sunlight and acquiring vitamin D through that particular mechanism, you have good nutrition, then I think you should be fine. So I think there's no good real evidence that taking the additional supplementation will play a role in terms of protecting you against this particular infection.
All right, thanks very much for that, Adrian Puren from the NICD. Just talking about those vitamin supplements, and I suppose just be as healthy as you possibly can at this point.
Good nutrition, that's very good common sense advice.
From your